Okay, Elliot, next I'm going to check out your head, your face, and your mouth. Okay, is that all right if I touch you on your head and your face and your mouth and look inside in your mouth and at your teeth and everything inside? Okay. Do you have any pain anywhere? No? That's great. So again, we talked about your head is a normal size and shape, which we call normocephalic, and everything looks good. I'm looking to see that everything in your face looks symmetrical. You don't have one eye up here and one eye down there and one ear up here and one ear down there, right? Everything is all in the spots where they're supposed to be. So can you smile for me? Can you frown for me? Can you go, show me your teeth, like a tiger? Great. So those are checking those things that I'm asking you to do. We ask you to do those so that we can check your cranial nerves. Those are the nerves that innervate all of your face and make your eyes move and your ears move and your mouth move. And we want to make sure that all of those things are functioning. And so when everything's working properly, we say that those things are intact. And it looks and it appears to be that your cranial nerve number 7 is intact and working properly. Thanks, Elliot. Okay, Elliot, next I'm going to have you do something for me. I'm going to have you squint. Can you raise your eyebrows? Great. And now I'm going to check your sinuses. Did you know that inside your skull, it's an empty, you have empty spaces? Do you know why you have empty spaces? Because if your head was one big, giant, solid piece of bone, it would be so heavy that you couldn't lift your head off your shoulders, right? So there's air pockets inside of your head. And those are called your sinuses. And you've got air pockets all in your head. So is it okay if I touch your face? Okay, I'm going to check your sinuses here, okay? Any pain here? No? Any pain here? So sometimes when you get a cold and you get congestion in your nose, those fill up with all the mucus that's in your nose and they get all swelled up with all of the gunk, and that's why you get pressure and you feel pressure behind your eyes and you get a little headache, and that's why you feel that. And so we check those things. And when we use the speculum and we look inside your ear, we can sometimes see that fluid in your ear canals, which runs right along here, and we can see that fluid because your ear canal, your tympanic membrane, is like a window into your head. And we can look inside and see that fluid. It looks like little bubbles behind that clear window, and we can see it. Elliot, do you ever grind your teeth? Do you ever notice that you grind your teeth?
Sometimes.
Sometimes. Do you ever have pain right here? No? Is it okay if I feel the back of your jaw? Okay. So what this is called your temporomandibular joint. Okay, can you go like that? Can you open and close your mouth? Okay. Any pain there? Any pain when I touch you there? Okay, great. The next thing I'm going to do is I'm going to check all of your lymph nodes. Do you know what your lymph nodes are? No? No? Okay, well they kind of filter all of the bad things in your body. They're like little sentries. And so sometimes when you have infection, they can swell up with all of the bad things that they're filtering. And so we feel for them. They're all over your body. Just a big system all over your body in various parts of your body. And so when they swell, they get kind of firm and we can sometimes feel them. So is it okay if I feel for your lymph nodes? Okay. So the first one I'm going to start is right here under your chin. Okay. And then I'm going to move back. And then there's one right here behind you. Right there. Does that tickle a little bit? Yeah. And then there's one right back here. And then there's one right back here. That's your occipital. All right. And then we have what we call a deep cervical chain. And it runs all the way down, like that, right in there. And then there's one right in here. Can you show your shoulders for me? Yeah, like that. So when you do that, it makes kind of a little divot here, and sometimes we can feel them in here. Okay, great, Elliot, thanks. The next thing I'm going to do is I'm going to check your carotid pulse. So your carotid pulse is the giant artery that sends all the blood up to your brain. Okay, is it okay if I touch you on the neck? Okay. And you never want to check your carotid pulse at the same time, because what's that big wrestler move that knocks people out? right? When they do like that and they knock them out, because when they're doing that, they're occluding both of these at the same time. No brain to your head and you pass out, right? You never want to do that, right? You never want to do that to your friends, right? So is it okay if I touch you there? Okay. And so what you're looking for is you want to make sure that it's not bounding. Ooh, I can feel it. Boom, boom, boom. You're getting plenty of oxygen to that big brain of yours. Boom, boom, boom. So there you go. It's +2, normal. It's not bounding. Okay, great. Thanks, Elliot. So we're working on your neck and your head right now. We want to make sure everything's working properly. We're going to check the range of motion of your neck. Okay? Can you touch your chin to your chest? Well, not with your finger, but I mean, can you do this? Like that? And back? Back like that. And can you put your ear to your shoulder? Like that? Can you do the other side? Like that? And can you turn with your head up? Can you turn and face that direction? Keep your shoulders down. Keep your shoulders level. Okay, now turn that way. Can you come back to center and then turn that way as far as you can? Great. You did great. Okay. Thank you. So Elliot, remember how we talked about those cranial nerves? Those nerves that tell your brain and your head what to do? So I'm going to check for cranial nerve number 11. Okay. I'm going to touch you on the shoulders and I'm going to ask you to do something for me. Okay. Can you push against my shoulder, my hands? Great. Okay. And can you push against my hand? Awesome. Can you push against my other hand? Awesome. Okay, so your cranial nerve number 11 is intact.